busy people getting fit in Fulshear, Texas. Our aim is to help you look better, feel better, and perform better as quickly as possible. I'm your host, Bryan White with Blue Eagle Fitness and Nutrition. Welcome. Hey, what's up, everybody? I am here with Dr. Doug Goehry from Airrosti. And just to let you know, I've been seeing Dr. Goehry, 3 years, 4 years?
Man, probably maybe a little longer
A little
because
longer?
COVID's added two in there that seem to have gone by in a flash.
So maybe 5 years, and not just me, but my wife. My wife sees you as well. Dr. Goehry is with Airrosti, and my favorite part about working with Airrosti is that he doesn't want to see me, and I don't want to see him. His goal in life is to get me fixed and ready to go in as few treatments as possible. So we're going to get to know Dr. Goehry a little bit. Good afternoon. How are you doing today?
I'm doing well, Brian. Thanks for having me, man. I really appreciate it.
Awesome. So tell us a little bit about yourself, your family, how things are going, and then we'll get into what you do with Airrosti.
So things with us going well. I'm married. My wife Jen is she stays at home now. She is, you can say, retired if you want, or just she's kind of stepped away from the teaching and the coaching role that she was in previously. She had been a volleyball coach for 10 years, and now she focuses on raising our three kiddos. We've got an 8-year-old Zeke, she just turned 6-year-old Josie, and a 2-year-old Elsie. And so they keep us pretty busy. Her, a little busier now that she's with them kind of full time, but I'm thankful that, we're in the position that we're in, that she can do that. And we're just trucking along pretty steadily. So.
Awesome. So 8, 6, and 2 boys.
Yes,
and
sir.
Girls, or
one boy and 2 girls.
1 boy and 2 girls. Love it.
Yeah. Although my son, he's been growing his hair out lately, and so he gets confused as a third girl sometimes, which I think bothers him. But we're pretty close to cutting it, so
Yeah.
that probably will happen no longer.
Okay, that's funny. So you are with Airrosti. How long have you been with them?
It's been a little over 6 years.
Okay. And you recently changed offices or moved offices?
Yes, sir. Yep. I was kind of located within some treatment rooms within a primary care office over near the Memorial Hermann Hospital. And recently we moved into a standalone location that's right next to the new Pearl and Vine restaurant off of 1463 and I-10.
Perfect. Yeah. I love Pearl and Vine. So, connect yourself with them, as much as possible. Great place for a date night, an anniversary. That actually was going to be one of my questions that came up later but we'll talk about now. What's a perfect date night for you?
Maybe it's just because it's fresh on my mind, and both my wife and I went to Texas Tech, and with our basketball team in the Sweet 16 tomorrow against Duke. I think a perfect date night would be a Final Four game, to attend, like a Final Four game if we were a part of it, of course. And then, dinner at a nice restaurant. That would pretty much sum it up. We're pretty simple people. We like sports and we like good food. So anytime we can put those together, that's probably a pretty, quintessential date.
Oh, awesome. That's pretty good. I like it. Yeah, I wasn't putting that together, but that would be a nice date for me and Celeste as well. So tell us more about Airrosti.
Airrosti as a company has been around for about 15 years or so. And essentially, we're just a group of providers that focus on seeing patients, trying to minimize the need for excess, imaging, or, if we can help patients get better without, the need for medications and things like that. We want to try to do that. Obviously, we don't always do that. And some patients need that escalation of care, and that's okay as well. Within the scope of what we do, most of us are chiropractors, like 95% of us. There are a handful of us that are doctors of physical therapy. But essentially, we see patients for an hour. It's one-on-one care the whole time, 30 minutes with the provider, such as myself, and then 30 minutes doing focused rehab exercises, basically just ways that we can equip the patient, like you said, to get them better faster, and then hopefully in the long run keep them out of our office. Not that we don't want to see them again necessarily. We love our patients. We just don't want to adopt them. And the more cost effective and time effective we can be with our care, I feel like that makes for a better service to the patients. So that's what we try to accomplish.
Cool. And I see you're wearing your Airrosti t-shirt. Do you
Oh,
normally
yes,
wear
sir.
a t-shirt into the office?
No, sir. So Wednesdays are days that I don't treat patients. It's not a day that I typically dress like I normally would, which is typically like an Airrosti golf polo. So I'm a little bit, more done up on those days. But on Wednesdays, I kind of serve in another role, which is to kind of mentor other doctors. It's kind of a coaching role, if you will. The actual title is regional clinical supervisor, but I gotta be, I feel I learn just as much as, I feel I learn as much from the docs that I support as they hopefully do for me. But it's essentially, it's a role where I coach or come alongside and help them out. So it doesn't usually require me to be as dressed up. And today I was meeting virtually with most of my providers, so it offered me the opportunity to be a little bit more casual.
Okay. Now you met virtually like over a Zoom call or
Yes, sir. Typically, we'll utilize Teams to meet up
okay.
and just kind of discuss how things are going and ways that I can help support them if there's anything they need from me, specific cases that may be challenging, ways that we can workshop that together, those kinds of things.
Okay. Very cool. Very cool. When so people listening to us right now, they're wondering, okay, Dr. Goehry's with Airrosti. When do I go see him? When should I mean, I feel like I'm always sore from my workouts. But when should I go see you?
That's a good question. And I feel like even patients who aren't athletes per se get, the standard muscle soreness, not necessarily DOMS if they're not, working out, but the kind of like muscle tightness that you get from just prolonged postures and things. Um, Anything that's like that, all the way up to ache or pain or sprain or strain that you incur from either working out or from normal day-to-day stuff. Sometimes we just have to wake up wrong and the back goes out, or we have a crick in the neck, or our knee is bothering us on the commute into work, or whatever the case is. If it's something that you don't think is torn or broken, a lot of times it's something we can help.
Okay.
And sometimes obviously those things come into our clinics and we do our best to try to identify those as quickly as possible. Sometimes again, that doesn't necessarily happen with us, since we don't have, I don't have MRI vision, but eventually we'll get that patient onto where they need to be, and usually sooner rather than later.
Cool. Cool. Yeah, so when someone comes and sees you, like, what type of injuries do you see more most often? Lower body, upper body? Are they strains, sprains?
Low back is number one. And I would say a good bit of lower back pain that I see, it kind of depending on how it presents, but a lot of it is really more from sedentary lifestyle than more active lifestyles. People who sit for long periods of time at work, those kinds of things, which also tend to lend towards upper back, neck, and shoulder stuff from staring at a laptop, or being my engineers who are on CAD and they're using their arm all the time and just using a mouse. Those kinds of injuries tend to present the most. We do see a lot of, I would say, like I said, low back number one, neck and upper back number two, shoulder would be a close number three.
Okay.
After that, hip, knee, foot, ankle, plantar fasciitis, occasional tennis elbow, those kinds of things, occasional carpal tunnel. Yeah, I mean, it's pretty extensive, headaches even. But yeah, the top three, I would say for sure: low back, neck, upper back, and shoulder.
Okay. Okay. Yeah. Good to know. Good to know. Because I know, especially when you have kids and your kids hurt. Okay. Do I need to? Is this a little boo boo that I kiss and make better, or is this an emergency room? Is this urgent care? And then when it happens to us, we're like, we'll walk it off.
Yeah, yeah, that's a good point, and it is funny how we kind of do that with our kids.
Okay, switching gears just a little bit. What does a healthy life look like to you?
Like what does like for me
For you,
personally, I
yes,
think
for you in Dr. Goehry's life, what does a healthy life look like to you?
so eating right, and that's different for everyone. I think nutrition is a personalized should be a personalized approach. For me personally, since November, I've kind of had some things revealed about my own, dietary habits and foods that agree with me more than others. I don't have food allergies per se, but I do have sensitivity to certain things, hypersensitivity to certain foods. Typically, things that would give me issues kind of fall on the lines of any dairy, gluten, kind of the ones that fall on a lot of people's lists. With that, really most grains would kind of cause a bit of inflammation for me. There are even like types of meats that would do it, beef and chicken and turkey, namely. But I suspect that that's more because those foods, when purchased through primary grocery stores, are grain fed and not necessarily grass fed or pasture raised. Um, so for me, healthy eating looks like whole food and as natural as possible, as minimally processed as possible.
Yep.
I don't steer clear of I still eat meat. I still eat a lot of meat. I actually kind of ascribe more to a ketogenic diet per se than just being completely plant based. But again, that's my own personal conviction. That can look different for someone else. And then working out wise, I've been trying to lift a lot more weights. I've naturally always been kind of a thinner, leaner kind of guy, and so for just overall health and well being within my practice and my life, as it's busy and kind of physically demanding, I want to be up for it, and so I've been lifting more weights over the last couple of months. And that looks like for me working out 2 to 3 times a week, trying to lift pretty heavy and just continuing to increase how much I can lift,
Okay.
practicing proper form along the way, and then proper recovery habits, making sure that I get adequate rest, that I don't drink too much alcohol, that would delay any of that. That I try to kind of keep a clear mind and keep work at work and those kinds of things.
Okay, so you mentioned rest. What is your sleep habits look? What do your sleep habits look like?
So that's been an area of kind of focus for me recently, because that's one thing that can probably use the most work. And a lot of my struggles there are because of the demands that I have of, like my son plays baseball. And so, sometimes
Sure.
practice will run late, those kinds of things. Sometimes I have to work on notes a little bit later than what I would like to if it's been a particularly busy day in the office, or whatever the case may be. Or it may be that we've done a lot during the day and I don't get a chance to work out until 8:30, and I'm not done working out until say 9:15. I
Okay.
kind of cool down, I stretch, it's 9:30. By the time I shower, it's 9:45, and then I don't have really any time to read or anything like that. But essentially, I try to be in bed around 9:30 to 10.
Okay.
I wake up around 6 o'clock every morning. I work out typically in the evenings or afternoons when I get home from work, or when we're done with baseball practice, etc.
Sure. Very
Yeah,
cool. Very cool. Yeah, we call that sleep opportunity, the time that you're in bed with the lights out. May
yeah,
not be asleep yet, right? Because we can't control when our body decides to shut itself off, but we can control
yeah.
when we're in bed, when we turn the lights off, and then we can control, when the alarm comes off, turns on, or when we get up. And so that's the sleep opportunity. So it sounds like you're getting 8 to 8.5 hours a night of at least sleep opportunity,
I'm
rather
trying
than
to. Yeah, yes,
sleep.
sir. Yeah, when things
Cool.
go well, that's the way it goes. Now, I'm I'm one of those. I'm thankful that I don't have like my sleep latency, the time it takes for me from laying
Yeah.
down to going to sleep is really short. I
Okay.
can I
That
can
lucky you.
Yes, I am very thankful for that. I can power nap with the best of them. Um, and I've learned that about myself, but at the same time, I can't let that be, a reason why I don't go to bed still early enough that I get an adequate amount of rest. So those are patterns in my own life I'm trying to improve.
Very cool. Very cool. Well, thank you very much for your time today, Dr. Goehry. I appreciate it. And where can people connect with you?
Our office is located right here in Katy, or I guess we already mentioned that. It's kind of right next to the Pearl and Vine office. I'm not too connected on social media. I do have a Twitter account. I usually just use it to follow sports and news trends and nutritional gurus that I kind of follow. But outside of that, my email address is, I mean, are you looking for like contact information or
Yeah,
just
if someone listening to this wants treatment from Dr. Goehry, what do they do?
Oh, the easiest way is to go to just airrosti.com. It's AIRROSTI. For the visually minded, it's right
Perfect.
there. Airrosti.com, and you can schedule an office visit schedule an appointment through the website. And then I should also say that since moving to our new location, being that I'm one of the busier providers in the area, we've had the opportunity to add a new provider, Dr. Brittany
Excellent.
Adewoye, and she's been really great to have on board here as well. And so many of my patients haven't been able to get in to see me, have been able to see her, and that's been really good. They've had good experience with her as well, and so we're thankful to provide that to patients also.
Perfect. Perfect. Well, thank you very much. And I am sure we will talk to you again soon. Have a great day.
Thanks, Bryan. You too, man.
Yep. Bye.
Bye.
You can get every episode of Busy People Getting Fit wherever you listen to your podcast or on YouTube. You can also reach us at busypeoplegettingfit.com. Until next time, thank you for listening.